Good evening. This is going to be my wound dressing video. I would like to show you my surroundings. Okay, so before entering my patient's room, I am going to perform hand hygiene. I have all of my supplies here, my dressing change tray, my unopened sterile Q-tip, Good afternoon, Mr. Jones. My name is Morgan. I'm going to be your nurse today. How are you? Good. Can I please have your name and date of birth, please? Okay. Can I please check your medical ID armband? Okay, thank you. So today I'm just going to be assessing your wound and also changing the dressing inside. Are you in any pain right now? Okay. Well, if you are in any pain, I'm going to have to go and get your pain medication, and I'm going to give it to you, and I'll come back in 30 minutes to assess your pain level so that we could go ahead and clean your wound and change the dressing. So I just arrived back at the patient's room after giving him the medication. After 30 minutes, his pain has subsided. Mr. Jones, can I have your name and date of birth again, please? Thank you. Can I please check your armband? Okay, great. I'm going to raise the bed just a little bit so I can get to that wound a little bit better, okay? So I'm going to put on some gloves. I just put my gloves on. Now, Mr. Jones, I am going to expose your abdomen area, but I'm going to cover your legs, leave the top part of your body covered, okay? So I only left what I need to leave exposed. I have my wound right here. So before actually changing the dressing, I am going to inspect the actual bandage on the wound. I have my clean gloves on, and I am checking for any drainage, any odor, any color, any discoloration of the bandage. How soiled is it? If there is any crust or purulent drainage coming from out under the bandage. So now I am going to take these gloves off, hand hygiene again, and put on new gloves. Now I'm going to take the bandage off. I'm also assessing what type of drainage is in the bandage. Is it moderate, no drainage, little drainage in the bandage? I want to inspect that. I want to inspect the odor of the bandage as well. Upon inspecting the bandage, after inspecting it, I'm going to discard of it, but I'm going to discard of it by folding it to ensure that the fluids stay inside. So I'm going to put that into the biohazard bag, not the one that's in my tray. I'm taking these gloves off now, disposing of them, putting on sanitizer again. Now I am going to unpack the wound. So if my patient did have any bandages in his wound right here, with my clean gloves on or with forceps, sterile forceps, I would unpack the wound with the gauze that is already in there. I'm going to discard of that in a biohazard bag. Once the wound is all unpacked, I'm going to inspect the wound itself for any discoloration, any drainage, what type of drainage, any odor. Is there any tunneling? Is there poor healing or prolonged healing? And I'm also going to ensure that there isn't any drainage bags or drainage tubes. If so, I want to look at how the skin is healing around that as well. So I have inspected the unpacked wound. So I'm going to dispose of these gloves. Now I'm going to set up my sterile field. Mr. Jones, I'm about to set up a sterile field to clean and pack your wound. I'm going to ask that you refrain from doing any sudden movements or do not touch any of the equipment, okay? Hand sanitizer is on again. So, I do have a clean, flat surface to work on. I am opening my package away from my body. Package is laying on, the top is laying on the floor, okay? I have to move my wound over. So now I am going to grab this first to create my sterile field, and I'm going to place it shiny side down. And I'm only touching that 1/2 inch perimeter that I am allowed to touch. Okay, that. Now my sterile field is laid out on the ground. Not the ground, Lord Jesus. My flat surface. So next I'm going to take my box from the bottom part. Ensure that the flap does not touch anything because it is unsterile. Now I am going to flip my box over. Let's just say that. Okay, so I have everything in my field. So next I am going to take my gloves and I am going to open them. And I'm going to place them right here where I can see, because I don't want to turn my back on a sterile field. And I'm only touching that 1 inch diameter. So my gloves are open, they're not touching my sterile field. I'm going to go ahead and glove my dominant hand by simply just pinching, and I did not touch the sterile field of the glove. And I'm going to maneuver my hand into my glove without breaking it. God willing. Hand is on the glove. Now I'm going to scoop. Keeping it over the sterile field. Let's try. It's still over the sterile field. Okay. Our hands are together now. I'm going to take my saline and I am going to pour it into my box. Saline has been poured into the box. Now, taking my Q-tip for cleaning now. If I did use a Q-tip for cleaning, I would have multiple Q-tips to clean. So when I clean, I'm going to go from center to outside, 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 center to outside. You don't want to scrub too much, just enough to get everything off. Okay. Next, I am going to take my forceps and I am going to take one to dry since we want to dry it. We are going to go from center to out, center to out. Next, and my gloves did not touch the wound. Next, I am going to go ahead and soak my gauze so that I can start packing. Okay, so next I'm going to just pack, and once again my gloves are not touching. Okay, so now that is tightly packed, I am going to take my pad with the blue side up. Take that on the patient's skin. Get my tape.
Code blue, 6A alpha, room 1. Code blue, 6A alpha, room 1.
the tape. Come on. And I just want to say that the bandage pad is extremely too big for this wound type. So when doing wound dressing, I would want to ensure that whatever bandage I am using to go on top of the dressing is the appropriate size and fit. Okay, so now I am going to discard of my products in the waste bag. I have my waste bag right here. I'm going to take off my gloves, perform hand hygiene, lay his bed down at the lowest level, put the call light into his bed, lower his gown again, make sure that he's fully covered, ask him how is his pain level now. After that, I'm going to tell him if he has any questions. Please feel free to call me if you need anything. Perform hand hygiene before I leave out the room. I'm going to go to the computer to document my findings on the wound, what I saw, and I'm going to check on my patient again in 15 to 30 minutes.